Hi, I'm Colette and I'm a children's community nurse. Today I'm going to talk to you about what to do if your child's button falls out. It's a common worry that parents have that their child's gastrostomy button may come out or get accidentally pulled out. Gastrostomy buttons don't nearly come out as often or as easily as nasogastric tubes. However, it can happen and it's important to know what to do if it does. It is really important that a new button or a temporary stopper, often known as an M-plug, is inserted within 1 to 2 hours to keep the tract open. If not, this may result in your child needing surgery. We have created this video to help reassure you and to teach you what to do if your child's button comes out. If you have been trained to insert a new button and feel confident doing so, then insert a new button. If not, insert a stopper device such as an M-plug to keep their tract open and contact your local CCN or attend your hospital to get a new button inserted. You cannot give your child any feed or medication whilst the stopper is in situ. It is purely to keep the tract open. You may have been given a different device depending on your local area. Please follow guidance given by your healthcare professional for this. Here is Tanya, one of our parents, who is going to tell you a little bit more about using M-plugs.
This is our emergency kit. As you can see, it's quite small. It fits into Dylan's lunchbox and we take it with us everywhere we go. It has in it the most important thing, which is Dylan's spare button. It's a teeny tiny little thing, just with a syringe, a button and a piece of gauze. The other things that we keep in the kit are these special plugs, they're called. If for any reason we couldn't get the button back into his tummy, if his button had fallen out, we would take one of these and we'd put this in instead of the button. Dylan's button is a 14. It says that here on the valve. And so we would look at the back of this. This packet says 14 is green. So we'd simply take this green button out, this green plug out. This plug is very soft and gentle. It's very bendy. It wouldn't hurt. And it would just push in where the button was. We'd tape it into place. And that would be enough to see us through until we could get somebody who could help us put the button back. If we couldn't get that button in, that plug in, we'd go down a size to the 12 or the 10. One of those would fit and it would just stop the stoma from closing up until we could get help. So also in our kit we have some tape, just because if we've taped one of those plugs back in, if we push one of those plugs in, if you don't tape it, it's going to fall straight back out again.
It is important that you do not allow the tract to close up. If you are trained and feel confident to do so, then insert a new button. If not, then insert a stopper device and contact your CCN or attend hospital to get support to fit a new button.